you. I want to ask specifically about how this policy might play out in ports and airports. And I understand that the specifics haven't been worked out, but I suppose to date we have been issued with a green list, and from what I can gather of people who fly into the country at the moment, 7% are contacted after that to see if they've isolated, and only half of those answer the phone when they're contacted. So I'm wondering if a big part of this policy would be enhancing that test, trace and isolate from the airport. And do you think that establishing, we saw also in the first week of green lists coming out, a lot of them were taken off the green list very quickly, and is it also important, in your opinion, to have a red list and to ensure that people coming in from red list countries are tested, traced and isolated more than from green list countries? Perhaps for Ms. Carney, or I'm not sure.
So I suppose what we're proposing essentially is that there would be no non-essential foreign travel in the first instance. And so over time, the idea is that there would be travel from other zero countries. In terms of how this is implemented, certainly a lot of work needs to be done to enhance so that the essential people, or those who are travelling in, that the systems are put in place. Certainly, anecdotally, my understanding is that the contact levels are pretty low, but I don't think the appropriate structures or systems have been put in place yet. So that would be a very important part of this.
Do you think the establishment of a red list would help in terms of testing on those flights more than from green lists?
So I think that's really problematic, as we've seen with the green list. It's a bit of a movable feast, and so I think the strategy for us, as we've said, is this idea of zero transmission. So there's the risk of importation of positive cases from other places, and so what we really need to focus on is that we have the appropriate structures in place to identify anyone who comes in who is positive, and to ensure that there's no forward transmission from that person.
For anyone on the panel who wants to answer, what is the biggest barrier in achieving this zero COVID island policy?
I think Professor Mickey has an answer.
Thank you. Well, it's partly in response to your last question and partly in response to this. I really wanted to talk to the issue of trust, because there's a lot of evidence that trust is really important in terms of people adhering to any policy. And test, trace and isolate requires trust, because the trace part of it, or tracing contacts and revealing contacts, means giving information about contacts. And what we found out in the UK, we have two parallel systems at the moment. One that is a national commercial organisation that has call centres, so people get phoned up from people they don't know, and the other is locally based, where locally based public health people contact people. Now, and the latter is shown to be much more effective, and a lot of the reason is the trust. People need to be able to trust where their data is going. They need to be able to trust that if they give contacts and information about contacts, that will be respected, and there won't be a punitive policy of asking them to quarantine without the necessary support. And in order to achieve this, it does require understanding the communities. Again, that's where sort of local knowledge comes in. And at airports, where you don't have that local community feel to it, I think what really is important, and in fact with all of it, is some kind of follow-up to ensure that people are quarantining, not being done in a punitive way, but being done to indicate how very important society thinks this is, that it's prepared to put some resources into following up. Again, in countries where this has been successful, it's been done with the door to door and knocking on doors to see, are people in? Do people need any help to carry on isolating? That sort of approach. So I think this whole area requires a lot of consideration and thought and behavioural advice to get it right.